Lung health checks are a simple checkup for people aged 55 to 74 and who have ever smoked to find out how well your lungs are working. Think of it as an MOT for your lungs. We get our cars checked every year to make sure everything is okay. Our lungs work hard every minute of our lives, so it makes sense to do the same for ourselves, especially at the minute. Most people who have an appointment feel very reassured. You'll have a virtual appointment with the nurse, either over the phone or a video consultation. The nurse will ask you some questions about your breathing and about your overall lung health. The appointment will take between 30 to 45 minutes. During this time, you can also get the chance to ask any questions and also talk about the ways you can improve your overall lung health. If you are still smoking and would like some advice about quitting, the nurse can help with that too. They may also talk to you about having a lung scan to check for any early signs of lung cancer. This is very common and is no cause for concern. If you are invited for a scan, it is done in either a mobile scanning unit in your local area or a local hospital. A CT scan is a type of X-ray, but it involves more radiation than a standard chest X-ray and shows more detailed pictures. It is used to check for any signs of lung cancer and lung disease. The scan takes around 5 to 10 minutes. There is no need to prepare in any way, such as fast or have any injections. Some people feel a little uneasy about having a CT scan, but it is a quick and painless procedure. You don't have to have the scan if you don't want to. However, if you do have lung cancer, the earlier it is caught, the better. If it's caught early, it can be cured, and someone who knows firsthand about this is Joe. Joe was diagnosed with lung cancer after attending a lung health check at the end of 2019. It came as a huge shock as Joe had no symptoms, is very active and hadn't smoked since she was a teenager. Fortunately, it had been caught early and Joe was able to have surgery.
I definitely did not realise that it is something, you could have surgery for and walk away. Yeah, that's just never crossed my mind. It's when the consultant I was speaking to used that word curative that I first thought, oh, you know what, you might just be cured. I do actually know of people who have not followed up on the invitation. Once I was talking to people about my experience, they've maybe said, oh, I think I got a letter. And I suppose it's, it's understandable. You don't want to go there. You don't think that it really has anything to do with you. It's just a very general check of the population. But my experience says, well, you don't know what you don't know. There's an onus on us to do our bit, and if we're being told that it would be a good thing to have a checkup, then have it. And if you value your health, why wouldn't you have it checked?
As Joe's experience shows, your lungs could be easier to fix than you think. If there is a problem in one part of your lung, treatment can focus just on the bit that is affected. The key is to get the problem early. If you are eligible, you will receive a letter from the NHS inviting you to a lung health check. You are invited whether you feel fine or not. If you have not received a letter, are unsure if you are eligible, or have any concerns about attending, please contact your GP.